We now examine structures in the abdomen, and we begin by orienting ourselves with familiar structures. We notice the jugular notch here, and inferior to that, we can see the sternal angle of Lewis. And then continuing inferiorly, we can see the xiphoid process. And from the xiphoid process, we can see the costal margin on the left and the costal margin on the right. Continuing in the midline, we can identify the pubic symphysis and pubic tubercles here. And we see running from the pubic tubercle to the anterior superior spine, we can see the inguinal ligament. Inguinal ligament on the left, and inguinal ligament on the right. We now identify important planes or lines. We can identify the midclavicular lines here on each side, and we can identify some important horizontal planes. We identify first the subcostal plane, which was at the bottom of the costal margin, and then superior to that, about halfway between the umbilicus and the xiphoid process, is the transpyloric plane. Then continuing inferiorly, we can see the transumbilical plane, which in Levi is at the same position as the plane of the iliac crests. And then we can also identify the plane of the anterior superior spines. Going back superiorly here, we can identify the domes of the diaphragm on the right, the dome of the diaphragm on the left, and we can see inferior to the dome of the diaphragm on the right, we can see the large liver, and we see it extends across the midline, and it's about 3 finger breadths below the xiphoid process as it crosses the midline, and then terminates close to the midclavicular line on the left. We note now at the junction between the midclavicular line and the transpyloric plane, we see the gallbladder, and then continuing to the left, we see a small dot, which would be the location of an enlarged spleen tip. And we note here halfway, a third of the way from the anterior superior spine to the umbilicus, we see an M here, which is McBurney's point, the location of the appendix. Now, coming back to the midline, we see just to the left of the midline, we see the abdominal aorta as it crosses into the through the diaphragm into the abdomen. We see it dividing into right and left common iliacs at the umbilicus, and it continues inferiorly. As it continues inferiorly, it becomes the external iliac artery, and then it crosses below the umbilical ligament. It becomes the femoral artery. We can identify now also at the transpyloric plane, we can identify the renal arteries.